Hello everyone. My name is Dr. Christina Shay. I'm from the University of Oklahoma Health Sciences Center. We're here today for AHA Science News. We're going to be talking this morning with Dr. Jaime Cespedes, and he's going to be discussing with us today his novel intervention, a primordial intervention looking at prevention of cardiovascular risk in young children. So Dr. Cespedes, would you mind introducing yourself and where you're from, your institution, and talk to us a little bit about your intervention that you presented this morning?
Of course, Christine. Yes, my name is Jaime Cespedes, and I am the director of the Pediatric Hospital at Cardio Infantil Foundation Institute of Cardiology in Bogota, Colombia. And this morning I presented our work, which is a collaborative work between our institution and Mount Sinai Heart of New York and Sesame Workshop. Basically, the hypothesis of our work is that we should start cardiovascular health promotions since early childhood. And our work demonstrated that. We developed school-based strategy that integrated the whole school community, meaning parents, teachers, and the whole community, with an intense 40-hour per month intervention to children during a 21-week period. We also selected this intervention in a low socioeconomic community in Bogota, Colombia, and we randomized 14 preschool facilities. We had about, at our beginning, 1,216 children, and 975 parents, and 175 teachers. In both groups, the intervention and the control group were very balanced at baseline. And after the 6-month intervention, we really found very significant and positive differences between the two groups. And that's why we were obliged to deliver the strategy also to the control group. And so the next school year, we gave the strategy to the control group. And again, we found that this control group maintained differences, significant differences after intervention. And what we showed here is that the 36-month follow-up of this cohort again is demonstrating that the knowledge, attitudes, and habits towards our main topical messages, which are heart and body awareness, physical activity, and a balanced and diverse diet. Well, we're showing that it can be done when you do this type of intervention.
How did the children respond? Were they excited by the intervention? Did they seem that can you give a little feedback on how they responded and their
Yes.
level of interest in the intervention?
One of the characteristics of the intervention is using Sesame Workshop materials. And the basic thought after this is that you should learn while you're playing. And while you're learning, you should have fun. I think it not only at the school age level, but at all levels in society. You should have fun while you're learning. So yes, kids were very enthusiastic. They participated, teachers as well, and the parents, because we had activities integrating all of them into the main message. Try to take care of yourself, know what your body is, your heart, what does it do, eat well, and do physical activity all day long.
Did you see a larger amount of change in certain age groups or sex differences? Were there anything interesting that you saw between the different types of characteristics of the children?
Yes, we did. At 36-month follow-up, we analyzed the cohort again, and we did a multivariate analysis. And what we found is that 3-year-olds and females did the best scores on the knowledge scales. And we also found that the kids maintained and grew their eutrophic status. That means their weight and their height, their BMI classifications were very well at the beginning and after the end. Our country has the double burden of disease problem. We have underweighted children and overweight and obesity as a problem. So what happened here is that the underweight children decrease, and the overweight kids decrease. They had a modest decrease. In the underweight children, that was significant. In the other one, it wasn't. But really, to change a trend is very, very difficult.
So you mentioned the intervention was performed in your country. Do you think that there are aspects of this intervention that may be well suited for implementation in the U.S., or aspects of the intervention that may be more difficult in a different regional area?
Actually, Dr. Fuster is implementing this strategy in about 25,000 kids in Spain and Barcelona. He has the support from the local government, and he is 4 years now into the intervention, and basically he's finding more or less the same result as we. And he also is starting the program in New York probably next year.
This is so fascinating to me because cardiovascular disease prevention needs to start as early as possible, and with the 2020 strategic impact goals really wanting to reduce the burden of cardiovascular disease, really starting before the risk factors themselves present themselves is very important. Do you have any idea, or do you have any thoughts on how this intervention and your results could affect clinical practice with physicians, obstetricians, pediatricians, what these results could be used for with implementation in the clinical setting?
Well, we have to change our minds as physicians, and we have to get out of the hospitals if we're going to deal with the population. We have to go over there and teach the populations what are they doing and how will this affect their lives on the long run. If we don't do that, then we're not in business. I do believe that not only preschool children should be targeted. I believe we should target pregnant women, and our primordial prevention should start since pregnancy and follow it through the life course. If that is it, then probably we can have beneficial effects after all.
So this intervention, you had hundreds of children in this study.
Yeah.
And you had the support of the schools, support of regional community efforts. Can you talk a little bit about your funding sources? Who supported this investigation? Where did the funding come from?
Well, basically this investigation was supported privately by Julio Mario Santo Domingo's Foundation. And because of his relationship with Dr. Fuster, he believed in his ideas, nobody else. And that's how we got started. And I do believe that policies at the government level have to change, but that's a hard task. So probably in order to show the government that this can be done, we should do research, privately funded, and then show the government that it can be done.
Very good.
And that's my main learning. This was in Colombia a low budgeted intervention, low cost, and yes, we are following up the court and probably need some support on that issue.
Very good. Well, I offer you the warmest words of support, especially with promoting cardiovascular health in children at younger and younger ages, and also with the families and the teachers themselves. It really takes a community to prevent cardiovascular disease from younger and younger ages. So thank you so much for your time and talking with us today.
Thank you, Christina.
And we'll look forward to seeing the results published and hopefully more follow-up underway.
Thank you so much.
Thank you.
It's a pleasure, and yes, we have to commit on this. Thank you.
Thank you. It's good to see you. Well, that's from AHA Science News, Dr. Cespedes with a primordial prevention intervention in preschool children. I hope the rest of you all have a wonderful time at AHA Scientific Sessions 2013, and we'll hope to see you soon. Take care.
Thank you.